Brought to you by GTA. We start with you.
Today's vaccination clinic went much smoother than yesterday's. Many criticized public health's day one process, as hundreds of those in phase 1A and 1C waited in line for hours that stretched for miles, only to be told that there were no more vaccines available. Some were even forced to take drastic measures and use the bathroom in the jungle. And although they were able to refer 150 phase 1C individuals, many were left more than unsatisfied. Today, day 2, DPHSS has taken a much more organized approach to provide the Pfizer vaccine, issuing numbers to the first 250 healthcare workers in their car and 350 ticket numbers to individuals 60 years and older. They even added a second vaccination clinic in the south at the Southern Region Community Center to service the first 200 individuals. DPHSS Public Information Officer Janella Carrera.
I apologize to each and every one of them. If that was my mother or my father, I would be upset for them too. So yes, absolutely. And I apologize to all of those who waited in line and had to be turned away. So we did sit down, we regrouped, we discussed it as an agency. How do we improve this process? How do we ensure that these people don't have to suffer through that experience again?
This overnight reformed approach allowed public health to conduct a much more organized administration of the vaccine. Along the way, we met this lovely couple, Kim and Parker. They're part of phase 1C and were here for the second day in a row. Yesterday, they waited in line from 9 a.m. to 2:30 p.m., a total of 7.5 hours. But when they finally got inside the Ukadu gates, they were met by personnel who broke the unfortunate news. They were out of vaccines.
We don't want to complain about the process. We know this is very, very difficult, and it's new to everybody, and who knew that the turnout would be so big, okay? So we can sympathize with everybody, but there are some pretty elementary things that could have happened to make it a little easier. We thought that we were going to get vaccinated by 3, and we heard on the radio that if anybody in line by 3 o'clock would get vaccinated. Well, as it turned out, the limit was hit at about 2:30, and so we were, very nice people came and said, we're sorry, you can try again tomorrow.
Thankfully, their second drive up wasn't in vain.
Today, it worked out a lot smoother. They were handing out numbers in line, and so we came early, but there was still a big line. And we were not sure if we were going to get in the count today either. But once we got our numbers, hey, everything else was smooth sailing. Everybody's been very, very nice. No complaints whatsoever. This staff is working very hard, and, it makes us proud of the kind of people that we're dealing with here.
We followed their journey as husband and wife as they joined the vaccination.
On a pain level, 1 to 10 scale, that was about a 0. So if people have any fear of needles or pain, they're not going to get it here. That was just a little stick and it was over.
His wife, Kim, on the other hand, would disagree.
I am nervous. Yeah, I don't like needles. I really don't. So I refuse to look at it.
But Kim took it like a champ, and they encouraged everyone to follow suit.
I'm so happy that I've finally gotten my vaccination. I feel just fine. I recommend others to get vaccinated. Okay, it'll keep themselves and their family safe.
Day 3 of Public Health's vaccination clinics will proceed tomorrow at Ukadu for the second administration of the Pfizer vaccine to the first 250 healthcare workers from 9 a.m. to 12 p.m., followed by the first 350 individuals in Phase 1C from 12 p.m. to 3 p.m. The Southern Region Community Health Center will also carry out vaccinations for Phase 1C tomorrow from 9 a.m. to 3 p.m. for the first 200 individuals. Through trial and error and re-strategizing, Public Health has successfully carried out the second day in their mission to spread the immunity in the community.